So I just read some orders from a case where it was being alleged, and then it's unfortunately probably going to come to fruition that there was copying and pasting of notes by, doesn't appear just to be the nurses, but probably the physicians as well. But it doesn't matter who it is. Of course, I'm only looking at the nursing stuff, but we don't do that. You don't copy and paste anyone's note ever. You write your own note. That is not defendable conduct ever. I don't even know why we're having this conversation. You are not even allowed to copy your own note from someone else's uh chart. Now hear me out. If you create a smart phrase, let's just say for PICC line dressing change, you create a smart phrase and that you copy and paste your own smart phrase when you do a PICC line dressing change because you do the same thing every single time. So are you allowed to do that? Yes, you are. But what you're not allowed to do is copy that from Bob's chart to Sally's chart and do that. No, you can copy from your own smart phrase, but you don't copy and paste from someone else's chart, nor do you copy and paste someone else's notes. I just cannot believe all these things that we are normalizing. I don't care what your job says. I really don't. You can think I'm as animated and activated as you want, but I told you she came to me with a letter of board of nursing, right? Her and her legal team. So please heed my words. Don't care what your job says. That's not how it works in this world. Too bad on your job and some of that stuff. I'm trying to educate them as well. You have to adhere to the rules and regulations that dictate your professional license. You, as the nurse, have to adhere to all evidence-based science, any rules, any regulations. That comes right from the Board of Nursing. We're not allowed to violate any of them. Even what if our job was saying that we're supposed to, we're not allowed to do that. 1514 in my own state, and I'm just going to read it. I have it memorized. I have a duty to the patient that supersedes a hospital policy or a physician order. So I don't know who needs to hear that, but please heed my words. Stop normalizing this stuff. Do not do things that are not in your scope of practice. Know that you're not supposed to do. Stay safe out there. Don't do this Mickey Mouse stuff, folks.